Hello again. We are here to demonstrate a Strep A test today, a rapid Strep A in-office test. So I have my patient here again. Hello, how are you? My name's Amy. I'm going to be your MA today. I just need to verify your name and date of birth, please.
My name is Penny Elaine and my date of birth is October 1st, 2000.
Thank you so much.
Thank you.
All right. So the doctor has ordered a Strep A test. Have you ever had one of those done before?
I have not.
Okay, so what we're going to do basically is we're just going to take a swab and we're going to collect a specimen from your tonsils.
Okay.
And then we're going to test it right here.
Okay.
We should have results immediately. It can feel a little weird. It can almost make you gag sometimes. So just, try not to do that, but everybody gags a little bit sometimes. So first thing I want to do is we're going to go ahead and we're going to wash our hands. I'm going to use some hand sanitizer. Okay, we're going to get some gloves on. Always safety first. All right. And then what I have set up on my tray here, just bring this forward a little bit, not to scare my patient at all, is I have my tray that's going to hold my test tubes and I have my reagent liquids. I have the test strip. I have a tongue depressor. I have the test tubes. I have a sterile applicator or a cotton tip swab. And then I have also, just to show you, a transport swab as well, okay? All right, so first and foremost, I'm gonna go ahead and get one of these test tubes out. And I am just gonna place it right in here in my little holder, okay? Let me pull this back just a little bit so you can see it better. Okay. Now, this is a transport swab, and I am going to go ahead and use this time. You don't always have to use this, but the reason we would use a transport swab in this instance is if, for some reason, these results come back and the provider is not real happy with them, doesn't agree with them, wants to go ahead and send a culture off to the lab. This is what we would have to send. So what I do is I usually take this swab and this swab and do it at the same time so I don't have to swab my patient's throat twice because it's not really comfortable. Okay? All right. So we're going to go ahead and get both of those out. I just open the end first so that I don't have to have my swab be out. Now, the transport medium here in the tube, I will go ahead and take fully out, and I'm just going to twist the top. I'm not going to take it off. I'm just going to twist it so that when I have this swab in my hand, I'm not fighting with it, okay? All right, I'm going to lay that down, and then I'm going to take this swab along with this swab, and we are going to just put them together like that, okay? This way I can hold them this way, and I can swab her throat with both at the same time again, so I'm not having to do it twice, okay? All right. Now, when I ask you to, I'm gonna go ahead and ask her in a moment, don't do it yet, to open her mouth, stick her tongue out, and I'm gonna put this tongue depressor on her tongue, and I'm gonna ask her to say ah. The reason we have our patients say ah is because when you do that, your uvula in the back of your throat raises up, okay? So here in a moment, I'm gonna do that. Now, once she has her mouth open, I have the tongue depressor holding her tongue down, and she has said ah, I am going to stick this into the back of her throat and quickly take a little bit of a swab, and in kind of a figure 8 motion, another little bit of a swab off of both of her tonsils. Are you ready?
I am ready.
Okay, so here we go. Go ahead and open your mouth, stick your tongue out, and say ah for me. All right, perfect. And she didn't gag. Excellent. This will go ahead and go into biohazard. These will, the red top swab that's going to the lab is going to go right into here. We're going to take the lid off of the tube, put that in there and secure that. We'll label that with her information here in a moment. This is going to go in to our test tube. Now we could have done this ahead of time. You can do it during, it really doesn't matter. 1, 2, 3, 4 drops of the yellow. One, 2, 3, 4 drops of the red. And then we will put that swab right into our little test tube there. Okay, let me go ahead and get these lids back on so we can secure those. All right, and we're gonna let that sit for just a second. We're gonna go ahead and swish it around a few times. Okay. And as I had noted on the past video, here is this particular, the box that this came in, and the directions are right on the lid of the box. Okay, so it says to rotate about 10 times, which I did, and then we're going to let it sit for about a minute. So we're just going to let that sit in there like that. While we're waiting, we can go ahead and get rid of some of our garbage, which this will just go into the regular trash. And then we can go ahead at this point and we can stick our label on this, which will then go into a biohazard bag that goes to the lab. Once it's labeled, we'll seal that up. We'll either send the orders via EHR electronically, or we would have a paper requisition that we would put into this little pocket right here, and that'll go off to the lab. Okay, it's been about a minute, I think. So now what we're going to do is we're going to go ahead, and if you see there's liquid in there, okay, also is the specimen that came off of her tonsils. So we want to make sure plenty of that stays suspended in that liquid. This is a plastic tube that we can squish a little bit. So as I'm bringing this out, I'm just going to squeeze and twist a little bit and squeeze to get as much of that liquid and specimen off of that cotton as humanly possible. And that's what I'm left with. I'm going to put this back in here. The swab will go into biohazard. And then we're going to go ahead and take our test strip. Okay. We'll go ahead and these are individually wrapped. Go ahead and get that out of there. And if you notice on the test strip, there's little wavy lines at the bottom. The little wavy lines are what goes into the test tube. And then per the directions on the box, we are going to wait 5 minutes for that to, I always call it cooking, but we're going to wait 5 minutes for that to come up with a result for us. Okay, so let us say that 5 minutes has elapsed, okay? Actually, I'm going to give it just a couple more minutes because it has not fully gone up there, so I can show you what that looks like. But after 5 minutes, we're going to go ahead and take a read on it. If there is a line at the top but no line at the bottom, that is a negative. If there's a line at the top and the bottom, that is a positive. If there's a line at just the bottom and not the top, that is invalid. And if there's no lines, that is invalid. Okay. And you don't have to memorize that. It is right on the box. Okay. All right. We're going to go ahead and say that the 5 minutes has elapsed. We'll go ahead and take this guy. We have got one line, but not another. One on top, not on the bottom. So therefore, she is a negative. However, if he goes ahead and orders it, he or she, the provider, goes ahead and orders it, this will go out to the lab and a culture will be done and we'll have results in probably about 2 to 3 days. All right. And then we will go ahead, again, this will go into biohazard. You'll remove your gloves, wash your hands, and dispose of everything. And that's it. Thank you so much.